Our mission as Progressive Health Center, we are a nonprofit organization dedicated to the optimization of good health care in the community, which means bridging the gap between traditional and non-traditional medicine.
As doctors, we're supposed to educate our patients. Docere comes from Latin, meaning teacher. And so we really need to teach our patients all these tools to give them to continue on with a productive, fulfilling life.
Alternative medicine or non-traditional medicine includes things like exercise, nutrition, stress management, massage, acupuncture, energy medicine are all forms of non-traditional forms of services or treatments that could benefit all of us.
When I was off of chemo and the surgeon said, "Go get strong," my daughter and I would go for 20-mile bike rides. I've gone to acupuncture to help with the tingling in my fingers and my toes, and that's hard to quantify, but I swear it's getting better. And even at the cancer center, they said, "Wow, usually it takes a year to regrow nerves, and you're showing that after 6 months."
Today is my 1-year anniversary since I was diagnosed. During the last year, I've undergone an amazing amount of treatment. And I would say that for me, from the very get-go, understanding how to combine Western medicine and all of the best that we have to offer with that, along with more of an integrative approach, was very, very important. And I'm so grateful that I found you guys in Progressive Health.
I would say be open to both Eastern and Western, be open to alternative therapies and things you can do, because you can, so much is out of your control, but a lot is in your control.
I've often looked at this cancer journey as sort of like Dorothy in The Wizard of Oz. And a storm comes in that you don't expect at all, and it takes you places that you never dreamt that you would go, and it brings people to you that you never thought.
My intent with partnering with hospitals was so that we could really provide services for the whole person, because traditional medicine does an awesome job of serving people who have to have surgery, things like that. But there's also the physical, mental, emotional, and spiritual components of each and every one of us.
And so I think that an integrative approach is essential. To treat any ailment in medicine, you really got to look at the whole person and all the factors that are playing into that illness or that problem.
I think the good news about today is that physicians are understanding that we can be a benefit to their patients, and we're receiving a lot more referrals or abilities to partner with conventional medicine, because they realize that they can't do everything for their patients. I think the hardest part is that financially there's not support for these services, especially for uninsured and underserved clients, patients.
I can't imagine having been through what I've been through without it. The programs where I can meet other people going through a similar experience or having gone through it.
One of the other projects we've started is a scholarship program for cancer patients, and it allows patients to come in for these kinds of services using a copay if they qualify.
I'm so happy that we've got this under control, and I get my life back, or it's coming back slowly.
I'm thankful for the community and people's awareness that today there are options in healthcare, and we're with us having the ability to empower people to really take responsibility for their health is so important.